Namaste, I am Dr. Mithun Oswal, practicing orthopedic surgeon based in South Bangalore, practicing in Sri Sai Ram Hospital, BTM Layout, Bangalore. Today, let us talk something about knee ligament injuries, especially anterior cruciate ligament, ACL injury. So what is ACL and what are the causes, how can it occur and what can be done next? ACL is basically anterior cruciate ligament. There are 4 ligaments in the knees. 2 are out sideways ligament and 2 are inner ligament, the crisscross ligament. The crisscross ligaments are called anterior and posterior cruciate ligament injuries. So anterior cruciate ligament injuries are very common because of the trending sports injuries. They come in sports injuries or people who are having these sudden twisting movements injuries of the knee. So basically this occurs in an younger age group, probably or it can occur in an elderly age group, but the knee being arthritic, we don't deal so much of a ACL thing post 55 or something like that. But people who are in their 20s to 20 to 50s, probably whenever there is an anterior cruciate ligament injury, should not neglect. Basically, anterior cruciate ligament supports knee, making sure that the knee joint is stable. It doesn't translate, the leg bone doesn't translate forward. So one thing is, like, whenever there is an ACL injury, what happens is, like, the knee is unstable. There's something kind of an apprehension. People start having apprehension while probably fast walking, running, or even while climbing the stairs or getting down the stairs, and it inhibits their activity of life. Or probably people don't have the ability to play sports or something like that. So whenever there is an ACL injury, whenever the injury to knee occurs, the basic advice would be to always visit an orthopedic surgeon. Make sure that the initial treatment is taken properly, and over a period of time, whenever there is an ACL injury, first thing is, like, to diagnose it. We diagnose it clinically, then we take an MRI. MRI shows a clearer picture whether there is only an ACL injury or along with that there can be some cushion damages or meniscal injuries. So whenever ACL injury, ACL never heals. Basically, whether it is a partial or a complete tear, ACL will never heal. Once it is torn forever. So whenever it is torn, probably you should not neglect it. You should make sure that proper treatment is taken. What do we do for ACL injuries? Basically, the treatment aspects have changed over a period of time. In the beginning, in probably 1980s or 1990s, whenever there was an ACL injury or something like that, either it used to be neglected or they used to do an open repair. Till 2000, it was an open repair. Open the knee joint, make a new ligament either through a patellar tendon or a hamstring tendon and put it back. That was an earlier treatment. These days we do something called as keyhole surgeries. Keyhole meaning minimal incision, minimal time of stay at hospital, and probably also we deal with less pain and the recovery is faster. What do we do here is, like, with a arthroscopic machine, we put in and we make sure that the knee joint is zoomed in, and through small holes we repair or we reconstruct the ACL. We reconstruct it basically through using either a semitendonous gracilis graft or through a bone patellar graft or a peroneus longus graft. So basically this surgery requires expertise and machineries. And also post surgery, the physiotherapy is main. The rehab protocol, whatever we do, is very important. The rehab protocol has to be followed, and once we do an ACL surgery, probably after 4 to 6 months, patient are back to their normal routine sports activities also, and their routine, whatever they are doing, they can do. The consequences of not doing an ACL are plenty. One thing is, like, knee being unstable, the activity of life comes down. Second thing is, like, the arthritis sets in early. The progression of arthritis makes one's go from bad to worst, and over a period of time the knee doesn't remain the same. The knee will have to be, it degenerates faster than as expected. So whenever you have a knee ligament injuries, kindly visit us. We can guide you in a proper way. We can suggest what can be done and how to go about it. It is not always that we should end up in surgeries. There are some treatment protocols for each and every injury, so we can do accordingly. Anyways, whatever said and done, only my take home message for you would be to make sure that whenever you have a knee injury, visit us or visit any orthopedic surgeon, take a proper guided treatment and make a call what to do next. Visit us if you have any issues regarding your knee ligament injuries. Thank you.